So we have Preservé, which is a new addition to Clareo. Preservé is a technique of breast augmentation whereby anatomic support structure of the breast is preserved, thus the name Preservé. So it's different than a traditional breast augmentation in that the pocket placement for the implant is a little bit higher on the chest wall than is a traditional breast implant pocket. As such, the Preservé technique is really more about shaping the breast than it is about achieving a particular volume. And so what I mean by that is the patient's anatomy constrains the size and number of breast implant choices we have with the Preservé technique. For example, the Preservé technique is not compatible with the round implants, only the teardrop-shaped implants, and it's only compatible with relatively small volume implants in the 200s, low 300s. The Preservé technique does afford patients is a much quicker recovery. There's less anatomical disruption of the breast. Patients can return to full activities within 2 weeks after breast augmentation with Preservé, meaning the gym, lifting their children. There's really no restrictions after 2 weeks after the Preservé technique. The buzz around social media that we do here is that the inframammary incision with the Preservé is slightly smaller than with the traditional breast augmentation. However, the real benefit is the postoperative recovery is just much faster. The ideal Preservé patient is a patient who is primarily interested in achieving or restoring a shape to the breast rather than someone who is interested in a particular volume augmentation or achieving a particular cup size. So postpartum women are the biggest patients in this, who fall into this category. They've had children, they may or may not have nursed, and their breasts are a little bit deflated and they want to just get that more youthful shape to the breast with, what might be considered a modest volume augmentation.